I'm Drew Schiller, co-founder and CEO at Validic. Our mission is to improve the quality of human life while building technology that makes personal health data actionable. SJF actually invested in Validic prior to our Series A. They led a bridge round in advance of our Series A. They were an early partner for us. I think we were one of, if not the very first healthcare investment for them. We fit really well into their thesis around how data can help to transform healthcare. And as a data-driven company that connects all the data that you capture in your daily life and bring it back into the healthcare system, it's really part of the healthcare transformation through data. SJF came to us actually at a really important inflection point for us. We had closed our seed round, actually led by Mark Cuban. And as we were starting to look for our first true VC institutional round, SJF became a partner for us through that whole process. And they were instrumental to us being able to understand the raise process, understand how to actually help build the business, and really serve as not just an investor, but also as an advisor for us in terms of how we were thinking about scaling our business in the market. Validic is helping millions of people today, and that makes me so proud and thrilled when I actually think about that number and the impact we're having. We've heard stories of people who their lives have literally been changed because of the fact that we've been able to get the data that they have from their daily lives into the healthcare system to be able to provide more personalized care. And that is just, it's really, really meaningful and impactful for me personally. And where we're going is, we now have data on over 4 million people active every single day on our platform, and we're starting to look at how can we leverage this asset to actually start to create more proactive healthcare. So we're starting to look at how we can start to predict when someone's going to have an adverse event. For example, we can predict blood glucose readings a week in advance. We can predict when someone's going to stop using a wearable device. We can start to cluster people and say, hey, based on the data that we have in our system and the data that our clients have, we can tell that somebody who's new to the program, once we have enough data for them on a baseline, we can say that this person's likely to have this kind of adverse event in the future based on the other populations that we've looked at in the past. So we can start to provide a lot more proactive healthcare, which will hopefully lead to healthier people and a lower cost of the healthcare system. But also, at the end of the day, for me personally, I just want people to be able to live their lives and be happy. And so being able to improve the quality of their lives is really important to me.